My name's John Orchard, and I'd like to summarise our paper on management of lumbar bone stress injuries in athletes with a focus on cricket fast bowlers. This will discuss how we tend to manage our athletes now, and how we do so is with very early use of MRI scanning using special bone windows with the MRI, and then if we do find a stress fracture, we unload from twisting activity with the aim of achieving bony union. And for most of the time with a unilateral stress fracture of the lumbar spine, we find that we can achieve bony union, but it does take many months. Now, we're a group of physiotherapists and sports physicians who we think we're world experts on this topic, in particular the topic of lumbar bone stress injuries in fast bowlers. We have published on the topic before, so why are we doing another paper? Well, we're not generally recognised as world experts in adult back pain, but we do read and respect the work of those who are the world experts in adult back pain, and we do have a lot that we agree on when we compare our work and their work. We certainly agree that most back pain doesn't require surgery, there's a minimal role for painkillers in back pain, and that exercise and progressive loading programs are the best way generally to manage back pain, both in adults in the community and in athletes such as fast bowlers. But we're finding that we disagree on one fundamental point, that the adult back pain experts generally avoid recommending imaging, as they feel that imaging is unnecessary and it leads to increased use of surgery, painkillers and exercise avoidance in adult patients. So the guidelines on adult back pain are that you should avoid imaging, and generally you should only image if you suspect that you might find a tumour, or if the patient has significant neurological compromise. Now, we're doing very regular MRI scans on the backs of fast bowlers, and we don't tend to find tumours, and we don't generally see neurological compromise. So this paper is looking into this disagreement and where adult back pain guidelines might be amended in the future if we can prosecute this argument that imaging is valuable in young athletes with back pain in order to diagnose stress fractures. And generally the management of back pain that's recommended in the adult back pain guidelines is that you should continue to do activities that you can do with minimal pain and ignore any structural findings that you might have found on imaging. Whereas we actually think that structure is very important in this group of young athletes, and particularly in cricket fast bowlers or athletes in other sports where the back's under regular twisting loads. Now, we're very convinced, we haven't done randomised control trials, but we're very convinced that by diagnosing stress fractures early and resting from aggravating activities until you get structural recovery will lead to extended athletic careers, and we're convinced of this in cricket fast bowlers and probably a lot of other sports that have heavy twisting loads. And we also think that if you've got a young cricket fast bowler with back pain that is present when they're bowling, the most likely diagnosis actually is a bone stress lesion, not a soft tissue condition, which was traditionally thought. So in this paper, we also then explore the question of which other athletes should get early scanning in the same way that we use early scanning on cricket fast bowlers, and perhaps by exclusion which athletes should be then treated by the normal adult back pain guidelines where imaging is avoided. So we think athletes whose sporting careers might be limited by a non-union of a stress fracture are the ones who we recommend early scanning for, and this would generally include high-level athletes, young athletes and those playing twisting sports. But it's also worth saying that an athlete who undergoes a scan needs to be prepared to avoid twisting sports for many months, perhaps as many as 4 to 7 months to achieve bony union. So if you do have an athlete who under no circumstances would be willing to avoid playing this sport for an extended period of time, maybe scanning isn't all that valuable in that sort of an athlete and you can manage them functionally.